Hi everyone, this is Mason Trang and I'm from Lighthouse Social Enterprise in Vietnam. And this is my second time presenting a poster for the CPRC Summit. And with my experience as the founder of the first LGBTQI plus mental health forum here in Vietnam, and as a very rising and enthusiastic advocate for this issue in the ASEAN region, I hope to give you a very clear context of the different challenges that the movement, LGBTQI plus mental health advocacy has faced within like the region and how we're going to move forward with some very clear and comprehensive recommendations. And the reason why that I think this topic is truly suitable for the summit is the fact that with the impact of the COVID-19 pandemic on global mental health and the surge of the different LGBTQI plus mental health related initiatives within the region for the past 5 years, and with a lot of attention that has been accumulated among different ASEAN LGBTQI plus activists in recent years, it's the right time, and we have the movement as well as the different experience that we have amassed over time in order to jumpstart a new movement that is stronger, that is more innovative, and that's what we're doing today. Definitely, I would want to address some of the very key barriers that LGBTQI plus mental health advocacy within Vietnam and probably other like ASEAN nations. The first one would definitely have to be like the lack of key foundational laws and policies related to mental health in general. So with like in Vietnam as well as other Southeast Asian nations, we still do not have any clear bodies of laws for mental health diagnosis, psychiatric treatment, as well as like mental health related professions are still not being considered as like real jobs within like the employment codes. Definitely that's something for us to like look out for, because how can we advocate for LGBTQ plus mental health when these very basic laws do not even exist yet, right? And the second thing would definitely have to be the scant public health resources that are available to everyone, just like general citizens, and particularly LGBTQI plus folks. So for a lot of Southeast Asian nations, the standard treatments would be psychiatric, so like drug treatments, and probably like other like modalities for treatment are very scarce, perhaps not even existing. So that means is that a lot of the different people out there do not have like the level of access to care that they would need and find appropriate. Not to mention the different things that LGBTQ plus folks would need further or extra, to have their needs met, given like their sexual orientation and gender identity related needs. And also, we have to talk about the fact that for Vietnam and a lot of other Southeast Asian nations, there's this very low mental health literacy that has resulted from, like socio and cultural contexts, like and religion that would kind of like hinder a greater knowledge for mental health and a true understanding for what certain mental illnesses would mean. So that could be something that would factor in the reason why, a lot of stakeholders and even LGBTQ plus people themselves participate very little in, advocacy for this issue. And lastly, last but not least, LGBTQ plus mental health has always been overlooked, and other like rights issues have and will continue being prioritized over like mental health. LGBTQ plus mental health has historically been discussed as an appendix of those issues, such as HIV and AIDS prevention and treatment, marriage equality, and gender affirmation law, stuff like that. So very rarely has it been, discussed on its own or to the fullest. So since we have addressed some of the very, key barriers that would really push back this movement, I would like to address and put out to all of you, like these very clear and comprehensive recommendations with the hope that we could move forward with greater momentum. The first recommendation that I have is for us to collect research findings that are recognized by different institutional bodies. What that means is that we are, conducting research with intentions of being acknowledged by the government and the different agencies that are going to do something about it. For example, like policymakers, and what those standards are. Um, you know, the first thing would definitely have to be like whether the research has a large sample size. And with my consultation with the government here in Vietnam, specifically the Ministry of Health, the standard would definitely be something like over 1,000, participants for a sample for a study. And that research study needs to have, like a very strong methodology basis, and definitely that research study should allow a lot of insights into the prevalence of a certain issue, as well as the related determinants or factors around it. And last but not least, the government and a lot of decision-making agencies, they would be very concerned about the fact that like this research was in collaboration with some prestigious institutes or sort of like research universities or colleges. So if possible, I would definitely recommend that we could collaborate with government affiliated research institutes. And, if we could take a step further, like if the government departments, consent, we would want to, collaborate with them so that it's going to be easier, so much easier for us, to have our findings being acknowledged by them, on papers, as well as, in the future, like if we want to if we want to, like lobby for a certain issue related to mental health, we already have that acknowledgement done. And then it's easier for them to take the matter seriously. The second recommendation that I have is for us to meticulously document the execution of certain innovative interventions that we have done or are doing. I've noticed in the past 5 years, there have been a lot of mental health related initiatives being put out for LGBTQI plus folks in the ASEAN region. But what I've also noticed is the lack of, detailed documentation of how we have been doing this, how we have evaluated our interventions, and whether, our intervention could be scalable in public health settings as well as community health settings. So the first thing that you would want to be very mindful, during your documentation is the intervention protocols, whether your intervention is evidence-based, like was it something that followed a certain model that was like rigorously researched, or something that is community-based, like something that really meet the needs and perhaps sometimes driven by your own community. If your intervention is truly innovative, how innovative is it? What's the approach to it? Like, does it resolve a certain issue or gaps or limitation that the current public health system has? And also, we have to discuss monitoring and evaluation, short for M&E. Um, it's something that we need to truly be mindful of. So things like multi-stakeholder acceptability, so whether different stakeholders from different sides find this intervention acceptable, whether this intervention is cost effective. That is something that's truly important because for the government to consider a certain intervention applicable for future scale up, it has to be cost effective. Another thing would definitely be the fact that like this intervention has achieved certain outcomes and certain impacts. So whether your intervention has accumulated a good rate of uptake, whether your intervention has significantly improved the well-being of LGBTQI plus folks over a certain period of time. And last but not least, we have to discuss scalability. So whether your intervention could be applied in the public health setting, which is something that is truly important if you're seeking a certain, advocacy for certain changes that happen in the public health settings. So whether your intervention could be, applied, like widely for different hospitals or clinics around the country, that's something that you need to demonstrate evidence for. Or if you're seeking, your intervention to be applied in community health settings, you need to demonstrate whether different stakeholders or different parties that oversee that or could potentially oversee that intervention would come to accept it. The third recommendation that I have is to integrate mental health related support into imminent LGBTIQ plus rights relevant law and policy changes. The reason why that I'm putting this out is the fact that I recognize that lobbying for LGBTQI plus mental health alone isn't always viable. There are always going to be many hurdles, and we have seen it and experienced that so far. So we would know what to come for. So in case that it isn't always viable and as productive as we want it to be, we could always consider, like another route or something as some sort of like a backup plan. And I think that is a truly good backup plan. And if we're trying to find a way to still advocate for LGBTQI plus mental health, we could definitely seek for certain LGBTQI plus rights issues that are on its way of being changed or improved in the next 5 to 10 years. And some of the issues that are going to be that are projected to change in the ASEAN region for the next 5 to 10 years include marriage equality, gender affirmation, protection from SOGIs, based violence and discrimination, and HIV and AIDS prevention and treatment. So you could look into those specific laws or drafts or revisions, whatever they might be, and you could potentially look for space where you could slide in, certain clauses or certain provisions or anything like related to mental health support. That could be a route for you to advocate for LGBTQ plus mental health. As you're doing this and as these laws and changes get affected, you're actually, generating more momentum for LGBTQ plus mental health as an issue so that in the future you can independently advocate for it without, integrating it into something else or under something else. And that's the reason why that I would like to remind you that even small integrations would count. And even small integrations would still result in the benefits and certain changes and improvements for the LGBTQ plus folks' well-being in the short term. So that's something that we should really look into. And the above, recommendations truly serve as clear trajectories for the ASEAN countries to jumpstart a new wave of mental health advocacy. And I truly believe that it's something that could be also, impactful and sustainable. And since, like the different ASEAN countries, like they share so much similarity when it comes to socio-political and cultural contexts. I truly believe that like these three recommendations could be well applied by the different nations within the region. And as like different nations apply this blueprint, there exists a space for us to collaborate and further each one of us missions to advocate for LGBTIQ plus mental health. Lastly, I would like to thank all of you, and I would like to once again call for the synergy among the ASEAN stakeholders and other international parties so that we could innovate LGBTIQI plus mental health advocacy for Southeast Asian LGBTQI plus folks. Thank you.